right, so my name is Melanie Lintela. I'm a Fisher alumni here and went up through residency at Highland, and I'm now helping oversee our umbrella program. So if you've been in the Rochester area for any period of time, you know about URMC, you know about UR Medicine. Highland Hospital is the 261 bed licensed acute care center. We're a community hospital affiliated within the URMC system. We're known specifically for our comprehensive women's services. I always hear people say we deliver the most babies in the city, even though we're the smallest hospital. I haven't verified that fact, but that is something that is kind of tossed around. And then we're really well known for our geriatrics program, as well as a lot of the special populations. So we have a lot of sickle cell patients that come in, a lot of cystic fibrosis patients that we see pretty frequently. In addition to some pretty extensive surgery programs. So we do a lot of joint surgeries as well as gastric bypass surgeries. So you kind of see a little bit of everything from the youngest babies to the oldest patients with the surgery and medicine all included. In addition to having a very extensive network of PCPs and APPE clinics. So we have a lot of affiliations, but one of the cool things about our program is that you can actually follow patients not only in the inpatient setting, but also the outpatient setting because of the way that some of our clinics are structured. And our provider teams that actually round at the hospital are often even the residents are often PCPs for our patients in the outpatient setting. Our inpatient pharmacy team is about 25 pharmacists, including our 2 PGY1 residents. And then we also have about 10 pharmacists at other locations, as I was kind of just talking about, between the outpatient and AMCare sites. So our core rotations are the acute care, obviously. So we have a couple different preceptor options. Dr. Slish from Fisher is one of our faculty member on site. So she does infectious disease consult. If you want to do that as acute care, I think we also could set you up as an elective potentially. And then myself and one other person, both Fisher alumni are medicine preceptors as well for acute care. Typically, I will take on most of the acute care people unless the scheduling doesn't work out, but we have a couple options for that. For AmCare, we have our Highland Family Medicine Clinic. So we have an embedded pharmacist over there. Her name is Amy. She's wonderful. And we do a lot of actual like sign out to her between our patients that are being discharged, and then we'll end up seeing the PCPs there in her office. And then we also have an affiliation we're going to be establishing with the Strong Ties Pharmacy as well. And then for a community, it would be the Highland Outpatient Pharmacy, which is right on site at the hospital, or also the Southwest Pharmacy, which is located at that family medicine clinic. And then for health systems, almost all of our inpatient pharmacists are actually preceptors for health systems. So there's a lot of options for that. But you'd be seeing a lot of the same people for your acute care and health systems as far as preceptors go. So that's one of the benefits of our a little bit smaller department, is that you get to know everybody really well because you're on site for several rotations and you see a lot of the same people every day. I didn't mention, so these are obviously the 4 core options. And we do have you do all of those on site with us. And then we also have the ability to do 1 or more electives with us. So we do ask that you do at least 1 elective with us, but we have flexibility with that too, depending on what your interest is. Our electives include infectious disease, as I mentioned with Dr. Slish. We also have an antimicrobial stewardship pharmacist who does full-time stewardship, as well as some work with our allergy department. We have transitions of care. So Aaron, who's on here, also is another one of our preceptors and works with these students a bunch, and he is a transitions of care pharmacist. We have a critical care pharmacist who rounds in the ICU. She's willing to take on electives, as well as our management is willing to do administrative rotation electives as well. And then we also just recently have an officially implemented emergency department pharmacist, and he is excited to take on students also. So we're obviously not a trauma center. Anybody who is trauma gets kind of stabilized and sent over to Strong, but we have our own unique set of patients that comes into the emergency department, and it also tends to be very busy all the time, depending on whose EDs are on bypass and who we're playing overflow for. So we still get a lot of interesting cases in our ED. In addition to these rotations, one of the unique things that we have about our program is actually that, sorry, we actually have people on our, yeah, you got your belt, go in the other room, please. Our mid-year project, so this is something that our program specifically implemented along with our interns. So each year our umbrella students are actually brought on site pretty early on so that they can complete a full project and then present at mid-year. So this is something really important going forward. If you want to do a residency, everyone's always looking for research experience, and we have had multiple different types of projects. We've done one on naloxone drip use in our sickle cell population. We've done one on Vanco and contrast use and whether or not that is affiliated with or causes an AKI. We did a DOE on iron sucrose use, actually, where I'm currently working on implementing a system-wide guideline from that project specifically. And then our current one this year is actually looking at C. diff adherence to guidelines as well. But I think the unique part about this is that you would be able to see it through from step one all the way to the end. So we use our interns who are generally a year below you in school, and they'll help with the data collection up front. But you can also be a part of that in the beginning, depending on when your rotations are happening. But you're part of the system, you're part of the project from the very beginning, so you see it from beginning to end. And I think that's a really important thing, to see each step of the process. And you'd submit your abstract. I just had a meeting right before this, working on the draft of our abstract for this year, and then they'll be developing the poster to bring to mid-year in December. So that's something that we really love about our program, is that we have the staff to be able to do that, and there's always projects coming up that are a really good fit for our students. In addition to that, we do a lot of committee work, obviously. So there's things throughout the hospital that you would be able to sit in on. You could be in a therapeutics meeting, you could present monographs. It's kind of whatever you want to make of it and how much you're able to be on site and commit to us. We love to have people, students involved as much as possible. In addition, because we are part of the URMC system, we have the benefit of being affiliated with Strong. So the last few years especially, we've been working really closely in collaboration with the UR Scholars Program. So you'll hear from Shannon in a minute here, but the UR Scholars Program will actually have multiple sessions throughout the year. These are some of the examples of the topics, but basically we're trying to give you a leg up on other students that may be bouncing around between different sites. But this is the advantage of you being with us all the time, is that we kind of get to know you personally, and we get to see what areas you may need more assistance in, or things you have questions about, and you just have a lot more resources immediately available to you because you're with us all the time.